I had such a wonderful day with my friend Bryony today. We walked around the city and went to the Montreal Museum of Fine Art to attend the George O'Keeffe and Henry Moore exhibit, as well as visiting Atwater Market, where we had the most delicious lunch and got some beautiful produce and enjoyed all the local goods.
This is Alicia Mathlan, just back from a trip to Montreal with her friend Bryony.
Yeah, I'm noticing, even though no one's formally saying it, that my girlfriends are planning trips with me.
So they want to give you experiences or they want to experience you?
I think it's both. I think we're all actively making memories together right now.
Before Montreal, it was Costa Rica, and there's a plan to fly to Paris soon.
Just be able to just stand there and soak in the art, just to see the brushstrokes. I see everything so clearly right now.
And you feel strong and...
Yes, I feel strong. I feel healthy right now.
Isn't that an irony?
The irony is this.
I think I'm actually thriving. I am not just surviving.
Say that again. That is an incredible sentence that just came out of your mouth.
I am thriving. I am not just surviving because of the support that I have here.
Alicia is thriving, even though she has ovarian cancer. She's chosen to end her treatment. But make no mistake, Alicia is a woman very much alive. This is Carry the Fire, a podcast by the Princess Margaret Cancer Foundation, featuring inspiring personal stories about what happens when world-leading doctors, nurses, researchers, and their patients come together to ignite breakthroughs in cancer diagnostics, research, and treatment. This is a podcast about innovation and radical hope. I'm your host, Lisa Laflamme. In this episode, dying with dignity and a new definition for palliative care. The story you're about to hear is a sad one, but Alicia Mathlan says it is also about hope.
So why don't you tell me
Sure.
what happened?
Okay. I will say that it's important to say that I hadn't had a cold, a headache, an ache, or a pain for 10 years prior to my diagnosis.
Picture of health.
Picture of health.
Then, on a trip to London, England, Alicia's legs started to swell up. When she got home to her small town, she went straight to the local emergency ward, where doctors gave her a CT scan.
And then they came back in and said, I think you should call a loved one.
That's the first thing they said.
Yeah.
You're laughing about it now, but how did you react sitting in that tiny little room across from the doctor who said that?
I think in my mind, I just froze and I thought, oh dear, this is not good.
What did they tell you?
They said that I had metastasis all over my body. So essentially, cancer was in my ovaries, my bones, my lymphatic system, part of my stomach, like all over my body.
What a shocking and unforgettable earthquake.
Yeah, I'm realizing as time passes, I'm forgetting more and more of my life before it, even though it was obviously a greater part of my life. Things are starting to be blurry or not as crystal clear. It's just a kind of before and an after.
Why do you think that is?
I think initially the immediate answer is that it was too sad. And also the treatments, the trauma, the medications impact your memory quite a bit. And, you know, I try not to miss my old life. Everything was different then. You know, I had more energy. I had the runway of future ahead of me was much longer than it is now. And so your perspective shifts. Even the way you feel about yourself changes. And there's just this before version of you, and then there's this after version of you.
This after version of Alicia was very sick.
I I'd always said something along the lines of, if I ever get cancer, I'm not going to do chemo. Because of how I felt about my body and my connection to my body, it just felt like something I didn't want to do to my body. I learned very quickly that it's easy to say that when you're not actually in the seat. And I remember thinking, it's okay if I go now. I was at peace with dying. I was at peace with accepting that this was the way my life was unfolding. And, a lot of people felt like that was a kind of giving up.
Well, you were what, a 42-year-old woman?
42, yeah. And for me, I just felt like it wasn't giving up. And even that language, it puts a lot of pressure on someone who's dealing with something so intense. But the way I had received my diagnosis, it felt to me as though there wasn't any hope.
Nevertheless, Alicia decided to seek treatment. She wanted more time with her family. What followed was 8 rounds of chemotherapy, a total abdominal hysterectomy, a partial omentectomy, where they removed part of Alicia's stomach lining. She came out of it all cancer-free for a month and a half. Then the cancer returned. She was told she had something called platinum-resistant cancer, which means, in simple terms, the chemo didn't work.
At that point, I met with the medical team, and their counsel was to seek chemo every week for the rest of my life.
Like in pill form or
Oh, no,
physically
come in
Okay.
and do chemo rounds.
Chemo to manage symptoms, not cure the cancer.
And based on just my values and my own beliefs, I didn't want to do that because, there's no recovery time, right? Like, it's one thing for you to do chemo, have 5 days of discomfort or pain, or, I don't want to minimize that time, but then you have like 3 weeks of feeling great and then you go back in again. But what they were really saying was you probably would have a day each week or 2 days each week where you would feel like yourself and you could maybe make plans, and then you go back into it again. And then you do this until it's just really not working anymore. And I felt very strongly that I didn't want to do that. Like, I was sure that I didn't want to do that.
So that's the biggest question of all, is how do you make the decision to jump off the treatment train?
I think we have to go back to the decision to get on it, because that decision was for the people that love me and that I love. That was for them to have more time with me, but not necessarily the course that I would have chosen had it only been myself in the world. Coming to this moment, fast forward to being told, like, if you want to keep going, this is what it's going to look like. I had to make the decision that, no, I really didn't want this for myself, because I wanted to live. I wanted to travel. I wanted to make memories. I wanted to prioritize joy,
When Alicia decided to end treatment, she came into contact with what would become her palliative care team.
Some of the cancer treatments have, for example, a 30% chance of prolonging life to a certain extent, but a 70% chance of not prolonging life, which isn't great.
Dr. Camilla Zimmerman leads the supportive care department at Princess Margaret Cancer Center.
For some people, that might be great odds, and they would want to go ahead with that, despite having a lot of symptoms. For other patients, that might not be acceptable, and they'd say, no, thank you. I'd rather not have the side effects and have a shorter life, but know that I'm able to enjoy that life a bit more and not be tied to the cancer center in terms of the treatments.
Dr. Zimmerman is describing what's now known as common sense oncology. Oncologists being very transparent with patients about their chances of survival and letting them make their own treatment decisions.
It's such a fine balance.
Mhm.
How do you strike that balance between, I mean, I guess we call it the reality and hope?
Well, I think, where there's life, there's hope, I think. And we can all hold out hope that we'll live longer. Sometimes you actually live longer without the cancer treatment because your body at a certain point is tired and damaged from the treatment and from the cancer itself. And the organ systems cannot support further cancer treatment. We've had patients who have stopped cancer treatment and come to our inpatient palliative care unit and actually recovered and done really well and lived for years.
So Alicia chose to end her cancer treatment and begin pain and symptom management.
How did you have that conversation with your husband and daughters and extended family that this was a moment you chose and a decision you needed to make?
I think I've always been very honest about how I'm feeling. I'm always very clear about what I'm thinking.
How did they react when you said, I'm done with treatment?
I think that to my face, they were, we understand whatever you need. We support you. We respect you. But I've heard rumors.
Families talk, apparently.
Yeah. I think everybody's pretty devastated and really, really sad.
And so are you. I can see it. I mean,
I am always sad now, Lisa, but
yeah.
also.
And yet I know that and I see it, but I also see so much joy in you. And it's fascinating, actually,
Well,
too.
It's, I think you start to realize, certainly after going through something like this, because it ages you rapidly, that, joy and grief are two sides of the same coin. And it takes a really long time in our lives to understand what that really means. But I think if I couldn't allow both to coexist, like I think if I was trying to suppress the grief all the time, it would be a form of self-harm at this point. The grief is there, it's ever present, but so is the joy. I have a really good life, and I actively participate in that life. I choose how my life is going to play out. Like every day I start at zero.
Starting at zero, with the help of an emerging, more modern perspective on palliative care.
Palliative care is really care that improves quality of life for people with serious illnesses.
This is Dr. Zimmerman again.
The focus is on improving quality of life in all of its domains, not just the physical domain, but also the emotional domain, the social domain, and the spiritual domain. And it's care not only for the person, but also for that person's caregiver and family. The family unit is seen as the unit of care rather than the patient. And it's care by a team, so not just by physicians, but also by nurses, social workers, psychologists, psychiatrists, and many other disciplines who get involved as necessary, really to provide whole person care. So the target isn't the tumor or the cancer, but the suffering that's associated with the cancer.
What do those conversations sound like with the patients?
So originally, when the patients come to see us, they are usually anxious because they associate palliative care with end-of-life care. So the first thing we do is to say, we're not here to talk to you about the end of your life. We're here to try to improve your quality of life. And by the end of the first visit, they are totally sold on the concept and realize that we're there to help them and to guide them through this very difficult journey, as well, just in terms of navigating the whole healthcare system can be difficult. And to have somebody who's there by your side, sort of guiding you in decision-making can be very supportive for people.
You said the concept of quality of life. And they're ultimately dying.
Well, we're all ultimately dying. I think
we
forget that.
We can't avoid it. That's the one thing that in taxes,
so
right?
our life does end at a certain point, and when you're diagnosed with any serious illness, it just makes that more apparent, I think. And for some people, it's something that they just do not want to think about, and they concentrate very much on curing and getting rid of the cancer and prolonging life. And it's important to know that that doesn't exclude palliative care either. So we're there to promote hope and to be with people in their hoping, but also to prepare them.
So this really is helping the living. This is not, I think that's where I really want to get a better understanding. Palliative care is for the living,
It is. It's
not
definitely
for the
living.
dying.
No, it is. It's for improving quality of life for anyone's remaining period of life, and it is not intended to be only end of life care. In fact, it's tragic when we see patients only at the end of life, because often they tell us, "I really wish we had seen you sooner, because we could have benefited from all that you have to offer for a much longer period of time."
Dr. Zimmerman and her colleagues feel that palliative care should start at diagnosis.
Even among doctors, it's often misunderstood as being end of life still, and I'm hoping that will change.
It's as much or even more for the living. Crudely put, even if we're dying, we're still alive. So how can Dr. Zimmerman and her colleagues make someone's life as good as possible? One tool in the palliative kit is an evidence-based psychotherapy program known as CALM, short for Managing Cancer and Living Meaningfully. It was created by Dr. Gary Roden. CALM is a series of individual and couples-based therapy sessions designed to help people navigate the 4 unique challenges of living with advanced cancer: symptom management and communication with healthcare providers, relationships with family and close others, the sense of meaning in life, and sustaining hope in the face of mortality. It's now standard of care in more than 15 countries.
I basically said to both like the CALM team and the palliative team, I said, like, look, I want to live my life and I want to have as much energy as possible. I want my mental health to be intact. I want my emotional health to be under management.
So what do you get from the programs, the supportive care program?
Well, first, it gives me peace because I know that all the stuff that is creating turmoil inside of me will have a place to land. I don't know if I said that like in a way that could be understood, but it's a very difficult thing to, get up every morning, wash the dishes and do all the things and also contemplate your mortality at the same time. So all this turmoil kind of whips up inside of you every day. And then it builds. And by the time I get to therapy, it has to come out. And it's a lot. Sometimes it's unbearable. And it's too much for my family. Like, it's hard enough for them to just know that I'm going through this, but to try and talk to anybody about it, it's, I was in an argument with my husband fairly recently, and he said to me, all you talk about is living and dying. That's hard.
Because he just wants you to live, but you have an outlet to come to sit across from a therapist who is also a cancer expert.
Well, and I think that is also incredibly important because you're not always having to explain what stage you're at. It is so important to be able to speak to someone who knows and understands the context so that you can actually talk about what you're feeling and what you're going through and work towards whatever resolve that looks like for that session.
The CALM program is also there for family and friends of those living with cancer.
We're doing couples therapy, and also he's going to therapy on his own because we're looking at 2 different futures now, and his happens to be a little longer. It's a bit of a sensitive subject, I'm sorry. But certainly being able to go to therapy helps us process how far apart we are right now. Yeah.
And it's a way to take the burden off of each other and put it onto the shoulders of the
of
the
professionals.
therapist. Fix me,
Yeah.
help me.
Yeah. And
But
fix
you-
us.
but
Try and
you-
fix
you-
us. Yeah.
But it's the whole picture here. So
Yeah.
many people think about cancer as a physical thing, and yet clearly
It's more
the
emotional, actually.
impact emotionally, mentally is
Yeah. I was someone in my, I guess, past life, let's say, who was very contained, very zipped up, you know?
you were not an emotional person.
I mean, certainly like on the occasions that called for it, I didn't have a problem crying. But I had learned to really bury my emotional states, you know? Like no matter what was going on, I could show up and be my best self. And I was probably able to do that right up until I had radiation in July of 2023. Because what led up to that, I had a metastasis, an unexpected metastasis grow on the back of my neck. And it was pushing on all the nerves in my neck and my spine and my shoulder. And the pain was such that I just said to my husband, like, if they can't fix this, I need to die. Like, it was just that intense.
The pressure on Alicia's neck was ultimately alleviated, but the emotional scars remained.
Whatever vestige of my ability to hold myself together was gone.
That was it.
It was gone. That was it. And I think we started doing 2 therapy sessions a week during that time because I was so destabilized. If I wasn't resting, I was crying.
How did it help? Like, how does just getting it out and saying it, what difference does it make for you emotionally to cope?
It's relief.
Okay.
It is the most tremendous relief and unburdening. Because at that point, I'm starting to feel like, why am I here? What am I doing here? Like, why am I living? I'm just causing all this pain to the people I love, and I'm in so much pain. I don't want to be here. And I say that as someone who has a lot to live for. And it feels in a way like being held when you're just falling, like you're constantly falling. And once a week, someone's there to catch me.
Is there any specifics you can share on messaging that might help others on what you've learned through that program?
Oof. I think there are 2 things. In the beginning of my diagnosis, Dr. Roden said to me, I think you have to stop trying to make your cancer convenient for everyone around you.
What does that mean?
I was still trying to be my old self. I was still trying to act like everything was fine. Like, yeah, sure. Like, yep, as soon as chemo's done, yeah, let's get on a call. And I was really working very hard and using a lot of energy to not have everyone around me feel like things had changed or that I had changed. It takes a lot of energy to try and be normal during this time. But in my mind, my worthiness felt like something, it had to do with my productivity, if that makes sense.
Yeah, I get it.
My worthiness felt like how well I could take care of the people around me.
So he says to you, stop making your cancer
A convenience.
a convenience.
And when he said that, it felt like I'm going to be honest, it felt like a gut punch. Because I wouldn't have seen that. I would have just kept going the way I was going. Because I didn't even know how to ask for help at that stage in my life. It was just never something that occurred to me. And it's still taken me almost 2 years to really understand that. And then now, in the therapy that we're working on now, it's more about just honoring myself. What do you want for you? And it seems like such a simple question, but it's a really hard thing to answer.
So they've sort of given you some training on how to make a decision for you first.
Yeah, it feels like sovereignty. It's given me an opportunity to try and connect to some kind of peace. We underestimate how important it is to have the words to articulate how we're feeling.
What are some of those words? I think that's really fascinating that there's a lexicon, if you will,
Yeah.
to get through this.
I think, for everyone, their language is going to be different. But for me, words like dignity keep coming back, self-respect, and also letting go. I've had to let go of so much. I think we all walk around with this inventory of pain of the things that people have done to us or what's happened. And even with my meditation and mindfulness training, I'm still human. And when you're told essentially that you have incurable cancer, it's interesting how quickly all of it evaporates. These things that you've been holding on to for years, or that you remember, or these hurts, or these childhood things, or, any residue or collateral damage from people who didn't know how to love you, that stuff, that it just evaporates.
I mean, honestly, when someone says, I've decided not to go through with the cancer treatment, our instinct is to immediately think they're going to be bedridden then until the end. And look at you. You are stunningly beautiful. You look like the picture of energy.
Thank you.
Maybe it's mind and body.
Yeah. Thank you. The most common thing people say to me is, you don't look sick.
How does that feel when they say
It's
that?
very weird.
Yeah.
It's very weird. But also, it takes a lot of work. Like, I don't want to sit here and convey this message as though I'm not actively working on this. Taking care of myself and my health is my full-time job now.
Health without regular use of addictive painkillers, something she gave up with the chemo.
So for me, not being on painkillers meant that I needed to exercise more. It meant that I need to work out more. I need to move my body more. Meant I needed to change the way I ate, right? And I'm grateful that the team here trusted me and trusted me to trust myself enough. I make choices about the company I keep. I make choices about when I go to bed. Like, I have to go to bed and be asleep by 9 o'clock.
What does hope look like for you?
Hope, I just want everyone in my life to feel how much I love them before I go. That's what I hope I get to do. That's why I'm so focused on my health. It is to ensure that the memories that people have of me are really good, are really loving and warm and generous and funny and gracious. So I guess hope for me feels like having a chance.
I've only known you an hour, and I already feel that all of those qualities have emerged. It's just been a great honor.
It's
talk
actually
to you.
been my honor. I had to manage my nerves the whole time because
Oh.
I'm really excited to be sitting across from you. So
Wow.
thank you.
Thank you for sharing such a personal story, and I know you're going to make a difference for other people.
Thank you. Thank you so much.
Some difficult news to share now. Since Alicia and I sat down together for this unforgettable conversation, sadly, she's passed away. Because of new approaches like common sense oncology and supportive care, Alicia died as she lived, courageously, on her own terms and according to her own values. In her final weeks, she became a beacon of inspiration to so many, using her social media presence to share heartfelt posts about embracing life in the face of death. She encouraged her followers to prioritize joy, find beauty in small moments, and live authentically, regardless of the circumstances. Her candid reflections on love, gratitude, and resilience touched countless lives and sparked meaningful conversations about what it truly means to live fully. We mourn her passing and thank her for sharing her story and wisdom with all of us. You've been listening to Carry the Fire from the Princess Margaret, a world-leading cancer research center. If you found this episode meaningful, please subscribe, rate, and leave a review. To learn more, check the show notes. And share this podcast with friends and family to help spread the hope for a brighter future. I'm Lisa Laflamme. Thank you for listening.